Are you hoping to have a home birth but have literally no idea what to expect? Well, you've come to the right place. Let's talk what you can expect at a home birth. Hi, I'm Alex. I'm a doula, a childbirth educator, and a mama of two, and I am passionate about helping other mamas feel fearless going into their labor and birth experience. I want to make a disclaimer that I am not a healthcare professional, and everything that I'm sharing in this video is just for educational purposes only. Make sure that you are with a care provider throughout your entire pregnancy and ask them any questions. Okay, so let's get into it. You've decided to have a home birth. Amazing. That's so exciting. But what can you expect? It can be a little bit daunting and a wee overwhelming when you make that decision and you and your birth partner have decided that that is what's best for you. So, first things first is to make sure that your care provider is one that supports home birth. So here in Alberta, Canada, which is where I am and where I serve families as a doula, you need to be with a midwife in order to have a home birth. So that looks like applying for midwifery care, getting accepted, and then having them travel with you throughout your entire pregnancy. At some point, you will let them know that you are wanting to have a home birth, and typically that's one of the first questions they ask. Where are you planning on giving birth? At home, at a birth center, or at the hospital? And so you just say, at home, I'd love to have a home birth. So now there are a couple of things that you can decide while you're still pregnant on what that looks like. First things is, where do you want to give birth? Do you want to have a land birth or a water birth? So a land birth is just a funny way of saying anything that's outside of the water. Okay, so a birth or a water birth. So do you want to give birth on your bed? Do you want to have a birth pool? Do you want to give birth in the bathtub? What is your ideal place of giving birth? Once you've decided that, then you should let your provider know, specifically your midwife if you're in Alberta, and they can help you plan accordingly. One really cool thing that comes with having a midwife is that they have a very different type of care structure, and that is informed choice as opposed to informed consent. So midwives really want you as mama to know what your choices are and to make them with the education and the information that a midwife has to offer. This is a great model of care for people who are wanting to be in control of their labor experience and feel empowered about how they're going to bring their baby into the world. Going with this type of provider allows you to ask questions and make really good choices that seem to fit you the best. Another great thing is that for most midwifery cooperatives, whoever you are paired up with, specifically again in Alberta, whoever your midwife is throughout your whole pregnancy, it is very likely that they will be the one at your birth. So throughout your pregnancy, your midwife will be able to talk to you about all sorts of different options and choices that you get to make as the parent of this baby, including different shots and immunizations that you can get throughout pregnancy and different medications to give baby immediately upon birth, including eye ointment and vitamin K. Another thing that you'll get to decide is whether or not you get your strep B swab or if you get Pitocin in the third stage of labor. So what's nice about this is that midwives have a schedule in which they follow to when they bring up these different choices that you get to make. So pretty much, I hope what you understand is happening is your midwife is helping you put together your birth plan as you go throughout pregnancy. Or they're not going to show up at your house and you're going to have to hand them a birth plan because they're already going to know what your hopes are going into that because they've been asking you these questions all along. Another thing that's great about having a home birth and therefore having midwifery care is that you're going to see, most likely, the exact same midwife at every single appointment. Unless they're partnered up, then you'll see them and their partner. But again, you're restricted to just the two people that will actually be at your baby's birth, which is kind of nice because one of the biggest things about having a home birth and giving birth in general is that you as mama need to feel comfortable, safe, and secure. And by knowing that your care provider is going to be there from start to finish and be the one that sees you in that very vulnerable state can be so good for your mental state. Okay, so That's kind of what you can expect throughout pregnancy. But what happens when the time comes? So when you are getting closer and closer to your due date and you've told your midwife that you want to plan for a home birth, they're going to give you a home birth essentials kit, which will give you all sorts of things that you need to have in order to have a successful and potentially the most clean home birth you can have. They're also going to give you a list of when to call your midwife and different warning signs to watch for and different early labor signs to watch for. This is all things that midwives will provide for you in those last few weeks leading up to your due date. Midwives will also become on call for you at around the 37-week mark. Again, in Alberta, Canada. So this might be different. Check with your provider with where you are. So from there on, they're going to be at your beck and call. Whenever you think you're in labor, they're going to want you to get a hold of them. Obviously, go back to the list that they've given you in one of those appointments as to when to call them and when to contact them. They're also going to give you an emergency call number for when you're in labor. This way, they will get rung no matter what time of the day it is, no matter what day of the week, they will be there to catch your baby. Okay, so now let's talk about when you're actually feeling contractions and you think labor is beginning. So a big thing is that when you feel labor beginning, you're gonna look on that sheet that they've given you with all of the things that they want you to go over. And when you start to show those signs, or if contractions are coming more consistently and with more intensity, they're going to want you to give them a call. So if you are a first-time mom, here's a couple of things that they're gonna look for so that you don't have to stress out about calling your midwife too early. When you call, specifically for a home birth, it's to hear whether or not you're going to be ready for them to come to help you birth your baby. Because you're not expected to travel somewhere or get to a different location to birth your baby, there isn't the same kind of rush, let's say. So if you call your midwife and it's you, mama, saying, ooh, I think contractions are starting, they're coming, this close together, lasting this long, and they've been doing that for about this amount of time, your midwife is gonna look at you and say, great job, Susan, you're doing awesome. How about you just keep riding them along and you give me a call when something changes, right? So they're gonna kind of know what to look for in labor. It's gonna be the call from your partner, or specifically the dad, when he says, I think it might be time for you to come over, and she hears you in the background going, ooh, or whatever the sound is that you might be making. That's what she's going to be hearing for. She's going to ask how close contractions are together, how often they are coming, and how long they are lasting. So typically, good rule of thumb is when you are getting a contraction every 5 minutes, lasting 1 full minute, and that's been going on for about an hour, that's a great time to call your midwife. If you have a doula as well and you're worried about calling your midwife too early, that's a great time to check in with your doula and say, hey, do you think we should call the midwife? I don't know if I'm getting closer or not. And your doula, although they can't do cervical checks because they are not healthcare professionals, they can kind of say, hey, you know what? I think let's wait a little bit longer until we hear something change. When I hear that change, I'll let dad know and he can call the midwife. So that's another great reason to have a doula, is they are ready to let you know when and how, because they do this. They go to a lot of births, right? So that's another reason to have them. So then let's say, dad calls or you call or someone calls the midwife and the midwife is like, okay, I am on my way. They will show up anywhere from 30 to 2 hours later, depending on where you are. If you're in an urban city, it might be sooner than that. If you are rural and out in the boonies, then it might take a little bit longer. And obviously that will be discussed between you and your midwife. But then your midwife is going to arrive at your home. And this is kind of where we're going to get into what your home is going to kind of look like. So if you are planning on having a water birth, here are some things that you can expect to see. You will probably want to either rent or buy a birth pool, or plan on giving birth in your bathtub, whichever you are more comfortable with. And if you're having a water birth, one huge thing to have on hand is a ton of towels. Have them warm, have them in the dryer, going so that once baby is here, mama and baby can be wrapped in a nice warm towel. Another thing, in the birth pool, most of them will come with a liner. So at some point, your partner, whether that's your husband or someone, or your doula, is going to be setting up that birth pool. So you don't want to wait too long to set that birth pool up, but you also don't want to fill up the birth pool too soon and be jumping into cold water. It's like the worst possible thing. It's super uncomfortable, trust me. So that's something you're going to want to be talking to your partner about or mentioning to your doula, and that will already be set up most likely by the time your midwife arrives. If you're having a water birth, that pool needs to be on some sort of water resistant or waterproof layer. So if you have carpet, we suggest something like a tarp or a couple of shower curtains, like those plastic shower curtains, along with towels. They're also going to want about 2 feet of distance around the pool so that no matter where you are, your midwife can come do checks and help you catch your baby. Another thing that they're going to want you to have at your birth is something similar to this. So this is just like a normal old sieve or strainer. They will use this to scoop out anything in the birth pool, including just anything that doesn't belong there. They will scoop out of that birth pool. Think scooping the poopies. Okay, so that's what this is for. They're going to want you to provide something like this. I suggest just going to the dollar store, getting something brand spanking new that you are okay with throwing out after your birth. Okay, so that's pretty much what's most specific to a water birth. So if you're planning on giving birth on your bed or just not somewhere that isn't the water, they're going to tell you to have some sort of new bed sheet or shower curtain on the ground or tarp, something to just make sure that you are not going to bleed or have other sort of fluids, including amniotic fluid, on the ground, just to try and keep it clean. So that's something you definitely want to get before you have a home birth, and it will be listed on your home birth essentials list. But when you are not having a water birth, there's a lot that, not a lot that they're going to expect, other than that wherever you plan on giving birth has that extra sheet or that shower curtain down. So especially if you are giving birth in bed, laying something down that can quickly be removed so that once you are postpartum, you can just jump right into bed and be warm and cozy is a really great option. So then once your midwife arrives, they are going to see how you're doing. They're most likely going to offer a cervical check to see how far along you are, and they're going to watch some contractions. So often midwives are going to want to show up when you're about ready for them to catch a baby. Of course, they are totally open to coming earlier than that, but really there's not much that they can do for you at a home birth regarding pain treatment. So at home, the best pain relief that you can do for yourself is to hire a doula. The reason for that is because they are trained in natural, hands-on, unmedicated pain relief options. And they are going to encourage you to change positions, to get into the shower, to use hydrotherapy, like the shower, or encourage you to drink water and move around and just do all the things to help reduce your anxiety around birth. So that's kind of what you can expect when the midwife arrives. But now let's get into when baby is actually being pushed out. So whether you're having a water birth or a birth on your bed or you're standing, because sometimes birth can be a little more spontaneous than we expect it to be, your midwife is going to be your best friend. They're going to be right up there with you. They're going to be watching for baby, very similar to what an OBGYN does, except that they're going to move with your body. They are not going to get you to lie down on your back with your legs up in the air. They will lay on the ground and catch baby if that is how a midwife needs to catch a baby. So you're going to be able to birth in whatever is comfortable for you. So as baby is coming into this world and you give birth to them, here are a couple of things that you can expect to see. So immediately after you give birth to baby, baby will be placed on your chest. So this is a great time to honestly just be naked. You're at home. Feel free to just, let it all out. But if you are more conservative and you would like to have something on, this is a really great time to get your husband or your doula to help you take off any shirt or dress or something that you have on so that baby can be placed immediately on your chest. They will then perform a couple of exams that they just look at baby and watch how they are doing to decide if any sort of infant immediate aid is necessary. If nothing is seen as necessary, then you will be given an hour to just live and love on that baby. Within that hour, they're going to check your bottom to see if you had any tearing or any lacerations, anything that might need to be touched up, and they're going to watch for the birth of the placenta. So a great way to get this thing flowing is to get baby onto the breast and try and get them to just nuzzle around and find the nipple to begin breastfeeding. Now, there is no pressure around having a first latch in that first hour, but if you are able to achieve one, then amazing. That will make the birth of the placenta a little bit easier. So if for some reason after, a certain amount of time the placenta hasn't been birthed, then your midwife will give you a shot of Pitocin. So again, this is something that I discussed, your midwife will discuss with you in pregnancy. So if you decide to have active management in the third stage, they will give you a shot of Pitocin while you're pushing. That way it just helps the uterus to continue contracting and cutting off the blood vessels to the placenta so that the placenta can come out with ease. If you decide to have a more watch and respond kind of approach, then they will wait and watch as you nurse your baby and get in all those loving snuggles. And then usually the placenta is pretty easy to be birthed. But if it isn't and it was your plan to be more attentive, then they will offer the option of Pitocin and watch for bleeding. So now let's say the placenta is birthed, your baby is here, they're touching you up and making sure that there is no tearing. If you have tearing, midwives are able to do most stitches for tears. If they see that you've torn maybe a little bit more than they expected and are uncomfortable doing those sutures, you might have to transfer to the hospital. Midwives are able to do various degrees of stitches as well. So they'll touch you up, clean you up, and then give you some time to just love on that baby. They'll help you move into bed. If you had a water birth, they'll get you out of the water and into bed. They'll bring you most likely something to drink and something to eat, unless your doula is already doing this, which they might be. So then immediately after, you can have something delicious to eat and drink because you just did the whole thing of pushing out a baby. Okay, so after baby is born, there are a few things you're gonna see. They will probably have one of these. This is a nasal and like throat suction, pretty much to just empty baby's airways. This isn't always a necessary thing that midwives will do, but they will have something like this to help with the emptying of the airways. They will also have 2 clamps that you can see here. They will be sterilized. And this will open and be put around the umbilical cord, and there'll be 2 of them. And I'm just gonna try and act this out here. And then you will also have scissors. So these will be disposable, just like these, that once you've had a home birth, you can just throw them out. So once that is clamped around an umbilical cord, dad or mom can come and cut the umbilical cord, and then the piece that is attached to the placenta will be discarded, and the piece that is still attached to the baby will be replaced by this. So this is a belly button clamp. As you can see, mine is broken because this is from my son. And yes, I am one of those moms who keeps the belly button clamp. I don't keep the belly button, okay? Just to be very clear. But anyway, so this will be put on baby's belly button or on baby's umbilical cord to help it just close properly so that we don't have any infection. So then once these have been used, Your midwives will discard these. The reason that I have these is because of my first home birth that ended up being a transfer to the hospital. So these have not been used for umbilical cord clamping or cutting, and now are just educational tools that I get to show so that we can remove any fear around birth as a whole. Okay, so now that baby has been detached from the placenta, and you have birthed the placenta, and you have gotten your beautiful golden hour to just soak up baby and let them nurse, they will then get to do their newborn exam with your midwives. So at this point in time, your midwives are going to take baby and be able to do it probably right on your bed. They're going to weigh baby, check their length or their height. They're going to do all of these measurements on the circumference of the head, and just a lot. There's a lot of things that they're looking at. If you want more information on that, feel free to ask your midwife what the newborn exams are and what you can expect. It's also in this time that your newborn will be given the eye ointment or vitamin K, if that is something that you included in your birth plan. And then once that exam is done, baby will be returned to you, and the midwives will usually hang out for a couple more hours to make sure everything is okay, to watch your bleeding, and usually to make sure that you've gone pee at least once, to make sure that there hasn't been any damage done there. Okay, so that's kind of what you can expect from like pregnancy to baby being born and the newborn exam happening. But what are some other things that you can expect to see at a home birth? So as I've already mentioned, you'll see something like this, because you'll probably have to provide this if you're having a water birth. You will definitely see umbilical cord clamps and scissors. Most likely you will also see a suction and an umbilical cord clamp. You'll also see potentially needles or IV starts. That's just a precautionary thing. You will potentially see your midwife come in with quite a few bags, and those bags have a ton of materials in them. If you want to know what's in them, go and ask your midwife. I'm just mentioning things that you're gonna see no matter what the birth outcome is. But if you have special questions, then feel free to ask them as well. Most midwives, especially in Alberta, I believe all midwives will come to your house with an infant resuscitation kit. So you can ask them all about what that includes. And they're going to have the newborn exam kit as well. So they have all the measuring tapes and things that they need to do to check all the things when your baby is born. Some other things that will be very, very, very clear to you is you are going to see a ton of these. So these are blue pads. These are sanitary pads. This one will be getting thrown out, but I want to show you because this might possibly be your first diaper. So after you've given birth to baby, your midwife will, and after your golden hour, I guess I should be clear about that, your midwife will most likely come up, hold this under you, like this, under your bottom, and help you move to the bathroom so that you can go pee, do whatever is necessary. These will also be laid on your bed for you under your bum. Honestly, potentially on the floor as you're giving birth. You know that your midwives think baby is near if all of a sudden they're pulling out one of these and prepping it on the floor, okay? So that's really just something that's easy to carry that allows them to drop something that's sanitary on the ground to clean up any bodily fluids. Some other things that you will see your midwife bring you is a peri bottle. This is just a hospital grade, very basic, standard peri bottle. Although I do suggest that you buy one that's a little more ergonomic, like this one, which is the Frida Baby or Frida Mom, I believe, one. Just helps you reach in the to the back area, especially if you have tearing. This is going to be your saving grace. I also love that it comes together and in this little carrying package, because if you decide in the first couple of weeks to leave your house, this is going to be a necessity to help dilute the concentrated urine every time you go to the bathroom. This is also how you're most likely going to clean yourself, because even if you don't end up with stitches, your undercarriage is going to be very raw. Some other things that you can expect your midwife to bring you is potentially a couple of samples of lanolin and diaper cream. So these were ones that my midwives provided for me in a little care package that they gave me at, I think, 37 weeks. So this is really something that women will use for their any sort of like nipple issues, nipple dryness or cracking. This is a great option if you're not allergic to lanolin. And then a diaper rash cream sample. So if you have already bought diaper rash cream, then great. But sometimes your midwives will show up with something like this. Another thing that you can expect your midwives to bring a couple of is some adult Depends. So these might possibly be your bestie postpartum. Honestly, girl, for the first couple of days, this or mesh panties with a big pad is going to be your saving grace. You bleed quite a bit at the end, like once you've given birth to your baby. You have about a plate-sized wound in your uterus. So to be prepared, your midwife will probably bring you something along those lines. I also encourage you to get something that you are comfortable wearing. And I want to make it very clear that like a normal daytime or nighttime pad is not going to be sufficient enough. You're going to think that you are over bleeding because you will be changing that more than once an hour. But if you're getting a maxi pad or a Depend like that, then you'll have a better gauge of how much you're actually bleeding. So those are some things that you can expect your midwife to bring to your home birth. I want you to know that there is a ton more, but these are just the basics of what I think is necessary for you to know to hopefully help you feel more comfortable, dispel a lot of fear that you might have around having a home birth, and just make it feel really normal and natural. Home birth is a beautiful option if you are a low risk mama because it allows you to give birth to your baby and then go into your own bed, be in your own space, and really heal and recover quickly without a nurse coming in every 20 minutes to an hour and a half to check on you. Your midwife will check in on you after 24 hours or sooner if they're concerned about you. Your midwives are also trained professionals, so if they see something that maybe makes them uncomfortable or they're not sure about the answer, they will not hesitate to send you to a hospital. I have a perfect example of this. My son, when he was born in January, had a little bit of a red mark around his umbilical cord, and my midwife was phenomenal. And she said, you know what, I just want to be sure. So at 24 hours postpartum, she sent me in to see a doctor at the Stollery Children's Hospital here in Edmonton. And she even called in, got me booked in so that I wasn't waiting forever. And he was seen and everything was okay. So I really appreciated that because it showed her integrity, but also showed that she's a professional and she knows what to look for in the sense of something going wrong. So that's what's great about a home birth, is that if you and baby are okay, you're going to be left alone to rest. And if your midwife has any concerns whatsoever, they are going to send you right away to see someone who can answer questions. If you're interested in why you should have a home birth, you can go and check out this video right here where I talk all about the benefits of having a home birth. If you liked this video as much as I liked prepping for this video, I don't think I've ever used so many props in a video before, make sure to subscribe, hit that little notification bell so that you know whenever I put out a new video. And thank you so much. We'll see you on the next one. Bye!